Well, we are continuing our conversation this morning on mental health, which is often a taboo topic. Now, while our series Enough, you just saw there, specifically focuses on mental health awareness for Black men, part of the conversation means we need to provide resources as we explore some of the ongoing concerns. Now, we'll add before we get into this conversation, if you have little ones in the room, some of this may be tough for them to hear. Joining me in studio, Dallas County Commissioner John Wiley Price. Thank you so much for being here.
Thanks for the invitation.
Absolutely. Look, we know you for sure as the commissioner. We've known that for decades now, but you have several other duties, and one of those in particular is you're the sitting chair of the behavioral health leadership team here in Dallas County. First and foremost, tell me what that team does and why is it necessary to have?
Well, it's a collaboration of mental health providers. And we recognize as we come together and collaborate, we're able to leverage our resources a lot better. And therefore, we know what everybody is kind of doing. And therefore, we can kind of target those particular issues that impact those individuals who can least probably afford it.
And I want to talk about something. Part of what we address in our Enough series is Black men, mental health, and of course, suicide conversations and the conversations that surround that. You sent me a report, and this report, and I don't want to get it incorrect here, by the North Texas Behavior Authority released by your team over a year ago, and it discusses suicide numbers in Dallas. What was your biggest takeaway from that report? Well,
the fact that it impacts everyone, socioeconomics regardless. But African-American men between the ages of 12 and 27 commit suicide at a higher rate. We saw a 6% increase. We recognize a lot of that was about COVID, but more than that, and the kinds of tools that are utilized to commit suicide. 12 to 27. You don't even know what life is all about. Anglos commit more in the latter stages of life. We did Hispanics, we did Asians, but it was African-American men. And so when you talk about 12 years of age, it gives me some concern. But I do want to applaud the Dallas Independent School District. They have 275 clinicians, everything from elementary school all the way to high school. And as you know, Dallas County, along with Parkland, basically published the Community Health Needs Assessment. So we talk about pediatric behavior, mental behavior with regards to that population. I think you'd be taken aback if you go out on the CHNA website and look at the whole issue of pediatric behavior. We can talk about mental health hospitals if we want to, but before that, there are mental health providers. Help is available.
Can I talk about that access to health? And you mentioned the CHNA that's out there that folks can get access to, but part of the reason that that was done is because there was a lack of access to some of this health care that's available. So can we talk about how folks can get access to not just the information, but just get access to care?
Well, one of the things it was imperative that we did with the Community Health Needs Assessment, CHNA, under the Affordable Care Act, it gave us a time specific to implement some of this access. And so what you can do now is that it's available. It's available in some of our COPCs. That's our community-oriented primary care clinics that are located in the community. And they are really about, about access. And so it is available. And all we need people to do is to reach out. But beyond that, we also have CHWs, which are called Community Health Workers. Those are individuals who are starting to reach out. Even though we're getting primary care in the community-oriented primary care clinic, we're looking at the social determinants of health. We also are looking at those individuals who come in for just what we call primary care. If the indicators are there that there may be some behavioral challenges, then now we have community health workers. This is all embedded. This is funded through Parkland Hospital. And so that's what the CHNA has done. They have appropriated millions of dollars to get community health workers to dispatch, go into the community to work with the community-oriented primary care clinics. And what we're saying is help is available.
I want to go back to the youth real quick, especially if we have any parents out there that may have students as a part of Dallas ISD. You mentioned some of the resources that are available there. If my child isn't directly acting up, maybe I don't even know that this is available. So how can families who have students in DISD get those resources that DISD has to offer?
Well, that's the reason they have the clinicians. And again, I want to applaud. By the way, this is the #1 ISD, independent school district in the nation, with 275 clinicians. And so when you look at what's going on in the elementary schools, you don't think about it. But there is one clinician for every 2 elementary schools. There is at least 2 for those junior high schools, and then 3 for senior high schools. One of the things that I, again, applaud DISD for is they looked at our community health needs assessment, and they plugged in other access in areas that were deficient. We don't realize it in this community. Transportation is an issue. 40% of my district is transportation deprived. We depend on buses. And so what they did is they went in with the community health needs assessment and they began to plug in access in those particular areas. So I want to, hats off to them. It's available. They're in the schools. Parkland is collaborating with them through their school centers. And so help is available. And my challenge has been to the new Secretary of Health and Human Services is make funds available to the other schools that are in Region 10 so that they can find the model of DISD.
And real quickly, Commissioner, what's the easiest way you would say to find the resources available? And are most of those resources free that you've mentioned?
They are.
Okay.
Those resources are free, and all you've got to do is to go out online and go into any of those portals, whether it's the Health and Human Services portal for Dallas County, whether it's Parkland, HHS, all you've got to do is reach out, and we'll, I think there was a song said, and we'll be there.
Oh, I'll be there. I know exactly what you're talking about. Commissioner John Wiley Price, thank you so much for being here with us and for sharing just this plethora of knowledge that we all need to hear. So appreciate that.